Prescription medications are a common component to most, if not all, fertility treatments. This means women going through fertility care need to take medication in order to improve their chance of conceiving. Depending on your individual situation, your physician will recommend the types and doses of medication that will best increase the likelihood of conception. So what do fertility medications actually do? There are several types of medications. Those that help the ovaries release mature eggs, those that prevent the release of eggs prior to harvest, and those that stimulate the growth of one or more eggs in a cycle. Fertility medications can be used in conjunction with both IUI, intrauterine insemination, and IVF, in vitro fertilization. Fertility medications can also be used to help women who are having difficulty but still trying to conceive via intercourse. Regardless of the specific treatments, fertility medications are meant to increase the likelihood of conception. There are 3 increasing levels of fertility medication treatments for women trying to conceive through intercourse or IUI. The purpose of these medications is to stimulate egg production in the ovaries. The 3 levels are oral, oral and injectable only. Common oral fertility medications include letrozole and Clomid, names you may have heard before. Some commonly used injectable fertility medications include Gonal-F, Follistim, and Menopur, all of which can be administered at home. Then, after a predetermined amount of time taking your medication, an ultrasound will be conducted to monitor your body's response. If everything is proceeding as expected, you will then take a trigger shot to induce ovulation. This starts a timeline for intercourse or your IUI procedure. If you do not become pregnant after medication and intercourse, or IUI, we may recommend you progress to IVF and a 4th level of medication. If you do move forward with IVF, or in some cases you may have started with it, you will self-administer injectable medications that help produce several eggs and prevent premature ovulation. Then, once your body is ready, you will again be instructed to take a trigger shot prior to your egg collection procedure. Finally, it's also worth noting that sometimes progesterone supplementation is also recommended with certain therapies, specifically treatments that include injectable medications. Progesterone is a hormone produced in the ovaries and plays a role in maintaining a healthy pregnancy. Progesterone can either be injected or inserted vaginally, depending on your treatment plan. Once you've been prescribed your fertility medication, you may be wondering where you can get them. First, if you have health insurance, we encourage you to check to see if any of your medications are covered. In some cases, insurance providers will require you to use a particular pharmacy. Regardless of whether your medications are covered by insurance or not, your provider will give you a list of medications and reputable pharmacies that have provided excellent care for our patients in the past. Like most prescription medications, there may be side effects. It is important to understand and accept the potential risks with fertility medications. You may experience discomfort, comparable to the feelings of early pregnancy or prior to your menstrual cycle. Under rare circumstances, you may experience ovarian hyperstimulation syndrome, or OHSS. This is when the ovaries grow too large too quickly. However, this is carefully monitored to decrease the risk of this happening. There is also a chance of multiple gestations occurring, which means an increased chance of carrying twins or more. So as you can see, fertility medications play an important role in your fertility and ability to conceive. If you have any other questions about fertility medications or any other part of the fertility process, please talk to your provider. They'll be glad to answer any questions you may have.